Hello everyone, welcome to week 3 of our tendinopathy course. So last week we were learning all about pathophysiology and tendons. We should now have a good understanding that we're moving away from a model of inflammation in tendons and tendinitis, and that we're using the terminology tendinopathy, and have a good understanding of the model that for tendinopathy that Cook and Purdom have proposed. It's a really useful and popular model these days, and helps to give us a good understanding of what's going on in the tendon. And you know, it's been really nice to see people learning from each other in the discussion forums. That's exactly what they're for. So, you know, there's a lot of people with a lot of different levels of knowledge in the forums, and it's really nice to see you sharing knowledge and people learning from each other. So that's been great, and I've been enjoying reading the forum, the discussions in the forum. This week we are moving on to assessment. Now, we are not going to propose to you a particular assessment to do for tendinopathy, because assessing patients is all about clinical reasoning, and it's about using your knowledge that you have and your clinical reasoning skills to perform an assessment that's suitable for each individual that you see. So what we're going to be doing is just covering some topics that will help your clinical reasoning as you go through the assessment with your patients with tendinopathy. So we'll be looking at pain and imaging and outcome measures and risk factors. There's a couple of great interviews this week. We're talking to Ebony Rio about pain and Sean Docking about imaging. So they are great to listen to. You'll gain a lot from listening to Ebony and Sean. It was a joy to interview both of those and listen to them talk. They've got a lot of knowledge to share, so enjoy those. And we're back to the case studies and another quiz. So just bear in mind that there's no set format for assessment, and just we're sharing some knowledge with you this week to help you in your own clinical reasoning for assessment. So enjoy this week. It's a good week, and I will see you in the discussion forums. We'll be there, so keep discussing, share your knowledge with others. It's really useful if if you have a lot of knowledge, be a teacher. That's really helpful as well on the course. So great, so enjoy week 3, and I will speak to you in the forums and speak to you again next week in week 4.